Well, there's two major ways that the school-based health center strategic plan will implement will help families and children in Delaware. And as I mentioned previously, we really have kind of two categories of groups that we're working with. The one group are existing school-based wellness centers, which have been around for quite some time. In order for these centers to remain viable, there needs to be improvements in the reimbursement system and in the integration of their services into the school system. So part of it is helping those existing centers remain viable. And this strategic plan is got significant elements that are designed to support that existing group of wellness centers, some of which, as I said, have been around since 1985. The other component is to really expand the reach of wellness centers into other areas, so elementary schools, possibly middle schools. So what this would mean for families and children is that right now the school-based health center model in Delaware is 95% high school. So if you're a school-age child, you're a family who has children in public schools, your first opportunity for a child to access this service would be in ninth grade. We'd really like that. We recognize that some of these supports that our children need start significantly before ninth grade. We also want to use this project as a way to help families navigate essentially the healthcare system in our state, because there's a component to the school-based health centers that's not just providing direct service, but it's also linking families to their primary care providers in the community. The school-based health centers are not meant to be a primary care provider. That's not the model. We have some students who have primary care providers, so that the school-based health centers essentially can be a stopgap in between an emergent need versus a chronic condition that the primary care provider would be supporting. We also have some students that are not connected with a primary care provider, in which case the school-based health centers are explicitly designed to connect those families with a primary care provider in the community. So especially with our younger students, which is why we're excited to be able to bring this service into the elementary sphere, we are looking to hopefully increase those percentage of children in the state that have access to routine primary care in the community.